If your baby was born with a cleft palate, surgery is usually the central step in a longer journey of care. A cleft palate is a gap in the roof of the mouth that forms early in pregnancy when the palate tissues do not fully join. Without repair, the gap makes feeding harder, lets air escape during speech, and raises the risk of ear infections. The surgery, called palatoplasty, closes the gap, separates the mouth from the nose, and rebuilds the muscles used for speech. Most surgical teams operate between 9 and 18 months, early enough to support normal speech development. Before surgery, the team checks that the baby is growing well, breathing comfortably, and free of any active infection. Under general anesthesia, the surgeon releases the palate tissues, repositions the muscles, and closes the nasal lining muscle and oral layers. The operation usually takes 2 to 3 hours, and most children stay in hospital for 1 to a few nights. In the first days, the mouth is swollen and feeding is gentle, fluids and soft foods, no hard items or straws. Over weeks, the swelling fades and feeding returns to normal, with the surgical team guiding each step of healing. Risks include bleeding, infection, breathing changes from swelling, and a small opening called a fistula along the repair. Cleft care continues for years: speech therapy, hearing checks, dental work, and sometimes additional procedures as the child grows. Older children and adults can also have cleft palate repair. Speech outcomes depend on therapy after surgery. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.